Often when people have a severe stomach pain, they might joke that they've got an ulcer. We're here to explain peptic ulcer disease. We'll talk about the actual underlying causes of this condition, its symptoms and manifestations, and the importance of timely intervention and comprehensive care. Peptic ulcer disease describes the condition where open sores called ulcers develop on the inner lining of the stomach, or the first part of the small intestine, known as the duodenum. The ulcer is a localized area where the inner lining has been damaged, exposing the delicate structures underneath. In the early phase, ulcers are shallow and can heal quickly, but in more long-standing cases, they can become deep and reach the muscle layer or erode right through the wall of the stomach or duodenum. The stomach produces acid and a digestive enzyme called pepsin to help break down food while the stomach churns and mixes these all together. The stomach and duodenum have highly effective mechanisms to protect their lining from the damaging effects of this acid mixture. Most ulcers develop because of a breakdown in one or more aspects of the protective mechanism. Ulcers can occur in rare diseases that cause very high levels of acid production, which overwhelms normal protection mechanisms. The most common causes of peptic ulcers are chronic infection with the bacterium Helicobacter pylori and a prolonged use of non-steroidal anti-inflammatory drugs such as ibuprofen or aspirin. This bacterium disrupts the normal production of stomach acid, leading to an overabundance of acid in the stomach, which can erode the protective lining of the stomach or duodenum. Contrary to popular belief, diet, stress, or anxiety do not directly cause PUD. The symptoms of peptic ulcer disease can vary, but pain is the most common symptom. The pain is usually in the upper abdomen, feels like a burning or gnawing sensation, and is typically worse on an empty stomach. The most common complication of peptic ulcers is bleeding. This can be mild with little symptoms except the stool turning black and tarry, or severe and life-threatening with the patient vomiting blood or passing dark red blood from the rectum. The most dangerous complication occurs when the ulcer erodes right through the stomach or duodenum wall, spilling stomach contents into the abdomen. This causes severe abdominal pain, an infection, and needs emergency surgery to close the hole caused by the ulcer. It's essential to consult a healthcare provider if experiencing severe or persistent upper abdominal pain, difficulty eating, leading to weight loss, vomiting blood or passing black stools, any signs of complications associated with peptic ulcer disease. If a patient experiences any of the mentioned complications, they should go to the nearest emergency department. For more information or to discuss specific concerns regarding peptic ulcer disease, it is best to consult your healthcare provider who can refer you to a gastroenterologist if peptic ulcer disease is suspected. We now have very effective medical treatments for peptic ulcer disease. These include medications to treat the H. pylori infection, as well as medications to help heal the stomach lining. Surgery was common in the past, but is now very rarely needed for the treatment of peptic ulcer disease. Being informed and having regular checkups is a great way to be proactive with your health and well-being. And you've done that today by watching this video. Give it a thumbs up if you found it helpful, and subscribe to the Ottawa Hospital's YouTube channel to get video updates on other health topics.